So this is the second video that I'm posting. I told you all in the last video that I would walk you through my journey after having this breast cancer diagnosis at the young age of a little over 30. Let's just say that. So anyway, I don't know why I found that so funny. That's silly. But anyway, really this week was it was I feel as though good week for me. I went and I saw another breast surgeon. Initially, when I had my ultrasound, as soon as that breast cancer center gave me the diagnosis, they were just kind of like, okay, well, we're going to send you, well, not send you, but they were like, we have doctors, we're going to refer you to a breast surgeon, we'll set you up the appointment with him and this and that. So I did go to that appointment. I really also, they let me know that this doctor would be the one that would have my pathology results, and that he could go over the results with me and kind of more explain in detail what cancer, other than breast cancer, give me more detail about exactly what was going on with my cancer. So I went to see him, and he was a nice guy. He was a really nice guy. His office staff, everyone was really nice. They seemed compassionate. They didn't like overdo it with the compassion. Like a lot of times, like if I tell somebody what I'm going through or whatever, they want to handle me with with kid gloves or something. But they weren't like that. They had compassion, but it wasn't like excessively compassionate, or it didn't make me feel like I was a lost cause or something. So I really appreciated them for that. They were nice ladies. He was a nice guy as the breast surgeon, but I didn't feel I guess like, I'm going to use the word safe to put it in one word. But to kind of expand on that, it's just that I really didn't feel like my care was going to be individualized and really a plan, like a McKinsey plan. It felt more generic. It felt like, it felt like he was just only focused on, okay, you have this breast cancer, and we're going to, excuse me, don't like that my undershirt is showing, and we're going to cut it out. And of course he did also say, with the type that you have, you'll have to have chemotherapy, this and that. And that's when I'm kind of like, okay, hold up. Like, oncologists, like, can we talk about a cancer specialist for a second here? And he did tell me, I'll refer you to an oncologist, this and that. And I wasn't feeling their sequence. I wasn't feeling it. Also, I did bring up to him that I was concerned about lymphedema. Now, I do understand when you're dealing with cancer, when you're dealing with something that's like life-threatening, and the solution to it, would lengthen your life, or give you more time on this earth. I know it's kind of like, for a lot of people, it may seem like a little trivial to be concerned about your arm swelling or something like that. People may not think like this is the time to be thinking of vanity. But for me, it's real, because not only is it unattractive, which can't be helped in some cases, I understand that, but also I heard that it's painful. I mean, your arm's swollen up, it's like fluid being retained. It's just not something that I wanted. It's not something that I would raise my hand and say, hey, sign me up for that. So when I mentioned that to him, I'm just kind of like, I'm concerned about lymphedema. Can we talk about that? Like, what can be done to decrease my risk of that developing? Because he did explain that I would have to have lymph nodes removed, maybe just a few, just to see if they had cancer in them. And he was really dismissive. His answer was that it's not something that happens often. He said, back in the day, we used to, I'm sorry, this hair is just really bothering me. He said back in the day, the solution was to, like, I guess remove, like, almost all of them or maybe most nodes under a woman's arm. But now, there's a sentinel, what they call a sentinel. I think it's a lymph removal, but it's a sentinel. I know sentinel is up there, the first word. Process that they do where they would inject the tumor with I believe a radioactive dye or some sort of dye, and basically that dye would then course through, and eventually it would end in the lymph nodes. That basically, if a cell were to leave this tumor, it would reach these lymph nodes, and of course they would find that because they follow the path that the dye goes through. So, those would be the ones that they would remove to just check to see if there's anything there. So, he was just telling me, like, I say he was dismissive because he was kind of like, don't worry about that. You know what I mean? And then he told me, he's like, well, one girl, we only removed one, and she ended up having lymphedema. He said, so, it's just really something that we can't call, and it's not something that really can be prevented. And in his opinion, it was something that really it occurred, no rhyme, no reason. So although I respect that he's a breast surgeon, he sees these cases all the time, probably every day. I don't. I only know firsthand of one person that's went through breast cancer and a mastectomy, and that was one of my aunts. And unfortunately, so this was in the 90s, and maybe, things have progressed since then, but I know that she did develop lymphedema. And I know, I think in her daily life, it doesn't really present an issue for her, but I know that she does experience discomfort, and it changes your way of living. You know what I mean? So, just with that, with him being kind of like, it's a crap shot, but don't worry about it, I felt ill at ease. I'm kind of like, that wasn't the right answer. So, also the type of procedure I wanted, which was, I wanted to go with the nipple sparing mastectomy, and he said that he hadn't done many of those, and he actually suggested not to have that. So I don't know. So but that's what I wanted, and he did tell me, he said, I'm not trying to change your mind if you already have it set, but I guess he really just didn't feel comfortable even doing that sort of procedure. That wouldn't be his suggestion, and he was, I'm going to say, inexperienced at it. A breast surgeon that has only done maybe a couple of that sort of surgery, I didn't want to leave that sort of surgery in his hands. So I did seek out a different breast surgeon. And I went to go see this breast surgeon last week. And I was super excited about the visit. She's a really nice lady. The staff is awesome. And she did something that he did not do. After she did the physical exam, filling around and everything, we actually went back to her office and we sat down. She gave me a packet of everything. She actually showed me, like, on a little, like, illustration where she would make her incisions, and she told me that she did believe that I would be a good candidate for the nipple sparing mastectomy, but she also wanted to first get an MRI, which I said, I believe in the last video, I did not want to wait for the MRI. I was like so ready to just get on an operating table and get it over with. But here I am waiting on the MRI. So I'll be going for the MRI on Friday. This hair is just so uncooperative. I'm going for MRI on Friday, and from there, oh, also on Friday, getting a mammogram, and from there, then we'll speak a little further. Um, Also, what she did suggest to me, she said there's a new drug for those that are HER2 positive, and it's called Perjeta. She said and this it works amazing. Um, so she would suggest pre surgery have the chemo. So let's do the sequence of chemo first, then then surgery. So from my understanding, chemo first, go that way first, is because Perjeta, which I don't believe is not chemotherapy. So first I'll have two I'm I guess maybe it's done in conjunction. I'm sorry, I don't want to confuse anyone that's out there. So don't take this as gospel. If you have breast cancer, if you're HER2 positive, please speak with your medical professionals about this. But from my understanding, I'll be doing two different chemotherapy drugs, and I'm guessing in conjunction at the same time. Also doing these targeted therapy drugs, which is Herceptin, and Perjeta is the other. So Perjeta, they explained to me, is a newer drug, specifically for those that are HER2 positive. And with Perjeta, this is a drug that you have to, I'm guessing like how it goes currently, is that this drug is only for pre-surgery at this point. And so supposedly with this combination, they're expecting this tumor to like shrink to almost nothing, or I don't know, maybe even disappear altogether. So I'm kind of excited for that. But I'm excited for that. But then when I spoke to the oncologist and told him what she suggested, because he was going based off of what I wanted. Again, I'm not a medical professional. I just knew I wanted the tumor out. So when I saw the oncologist a couple weeks ago, I told him, I'm going to get this surgery done. Then I'm going to come back and see you, do the chemo. And, he's just like, okay, fine. So after I spoke to her and she suggested Perjeta, I spoke back to the oncologist and he said, fine. He said, that sounds like a good idea. We could do that. Then he did tell me I have to come into the office and get a port placed into my chest. For the chemo, God. Ah, I think all my life I developed this coping mechanism of laughter when shit is really sad and not funny at all. So excuse me, but the laugh is like the laughter. I'm sorry if it comes off odd or weird, but I'm just trying to cope, y'all. I'm trying to cope. So that's the plan. So now, y'all, I have a legit plan. Chemotherapy, two different types. Also Herceptin and Perjeta. You know what? Also Taxol, if I'm saying it right. Taxol. That's being incorporated into this pre-surgery treatment as well. And I don't know if Taxol is a chemotherapy drug or if it's more of a targeted drug. I'm not sure. But that's the name of at least 3 of the things that I know I'll be going through very soon. I guess it's going to be pretty intense because it'll only last for 4 months. 12 weeks. Everything is 12 weeks. What I didn't get, and I should have, is if the 12 weeks are all, what do you call that? If that's like a cumulative 12 weeks, or is this going to be something that's like, one drug 12 weeks and then, like they're following each other. I don't know what the word for that is. Okay, but anyways, so that is the plan. That's the plan. I'm just ready to get it over with. Um, so I tell that whole story about going to the other breast surgeon, um, to not feel as though just because maybe someone referred you to a doctor that that's where you should stay, or even like if you have to travel a little bit, maybe if you have to go to the next town over or the next few towns over to really get the treatment that you feel as though is tailored for you, that's good for you. Because I mean, everything just ain't for everybody, and that's a super true saying. um I believe in the first breast surgeon. I believe in his ability to do his job, you know, to just cut some boobs off. I believe in that ability. And for a lot of people, maybe that's exactly what's needed, you know, just a total removal and, you know, proceed from there. Um, and then also for a lot of women, maybe that's just what they want. And that's fine. And those few or many can go see that provider and allow him to take care of things. Um, but it just didn't feel right. It didn't feel right to me from the very jump. Also, the second breast surgeon that I saw last week, she did hook me up with a breast oncologist. She gave me cards for plastic surgeons. Um, she also gave me a card for her I want to say coordinator. It's a breast cancer coordinator, which is a nurse in her office. She gave me her card. She also gave me her direct phone number that rings to her personal desk, the actual breast surgeon. You know, she said, look, if you ever need to call, give me a call on this number, which she wrote on her card. It rings directly to my desk. I'll get back to you within 24 hours. I'm good about that. Um, so my mind was really set at ease. I really feel like this is the right move for me. Also, another thing I did was I started to sort my paperwork out in two different binders. So I have a bills binder, which I hope that stack doesn't get too large. And then I also have a binder that's more of medical notes. Like every time I see the doctors, you know, it'll be just different reports, pathology reports, notes from office visits, things like that. Just trying to keep organized. And I think that organization also makes me feel like I'm on top. I'm on top of this thing. You know what I'm saying? Like I'm not really getting buried on under anything. Like I really feel good about everything. So that's that. I think that's really about it. And you know what, y'all? That's it. Uh, Once again, everybody out there that's struggling with this, try not to get down. I know it's a heavy load. It's hard to hear that you have this diagnosis, and it's hard to know that things could go way left. It's hard to, you know, it's hard in that sense. But I think that if you just believe, if you just have the faith to know um, that it's not the end. And honestly, and this may sound, you know, foolish, cliche, or whatever, but it's not the end until you want it, until you say it's the end. It's really not. It's not. I know we've all gone through things in life, and it's quite a few events in life that I could think back on right now. And while I was in the midst of those things, I was thinking like, this is it. Like, I'm done. But, you know, eventually, you know, time passes on. Some people may not believe that time heals all wounds, but I think honestly, in a lot of situations, time is the greatest elixir. You know, the further away you get away from traumatic experiences, a lot of times the better off you are. Um, you know. And sometimes you may need to go seek professional help. You may need to sit down with a therapist or someone to sort yourself out, and that's okay too, because everybody deals with trauma differently. Um, Everyone deals with just about any life experience differently. So just take care of yourself and just believe, have the faith, and just live and laugh and love and all of that good stuff. So I said to myself I was not going to make this all long and turn people off, because probably only a handful of y'all is going to wait to the end of this long video. So I'm sorry. But the next one, I promise, will be short. I think I'm going to start writing down what I want to say, so I just stick to the script and not torture all the people that are kind enough to actually click view. So anyway, stay positive, y'all, and see you next time. Ta-ta.